So this is the, I said, time and Zoom meeting, and morning starting time from 10 to 2, and evening from 6 to 9, okay, or 9:30 anyway. So fundamental of nursing is Monday, and I use the Zoom ID is this 893-531-0510, and the passcode word is, this is one, right? The small and capital letter. And I said Tuesday we use the my own Zoom ID 419-158-4759, but you do not need any password. I want to add you every day morning or evening class. Before class, I has to send you the Zoom invitation. So if you click the link, you automatically be joined in my class, or you can type this Zoom number and you can participate. And Tuesday we have to talk health assessment and also mental health nursing or psychiatry, right? Morning and evening, absolutely same. I said you do not need to join morning and evening both time. Which time is okay with you, you participate. I don't want to push you that you have to join both, no need. And other thing is, when you participate in my class, I have to take your percentage, your presence, and according to our school, you have to have 80% presence. So 8 weeks we have to talk health assessment and mental health. Basically, health assessment is first 2 hour and second 2 hour is the psychiatry. But some of the students get confused because of jumping from one subject to other subject. So I has changed something on demand of student requirements. What I do, the 4 weeks I discuss health assessment, and 4 weeks I has to discuss the psychiatry individually. And then Wednesday we has to talk the pharmacology. Pharmacology is super important, so we has to talk beginning to ending, morning and evening. And I said morning and evening class is absolutely same. Like if morning class, I should talk about the hypertensive medication or cardiac medication. Evening, I will also talk hypertensive or cardiac medication. 8 weeks. Then go Thursday, we has to talk pediatrics of nursing and maternity and child care. Maternity and child care, other way to talk, obs and gynae. Obs means obstetrics. Obstetrics portion discuss about the prenatal, perinatal, and postnatal care. I mean, dealings with the deliveries. And obs and gynecology means female related disease, right? So this maternity also included the child care, newborn care. So pediatrics 2 hour and maternity 2 hours. But I said according to the students' will, I have changed a little bit. First 4 weeks we has to talk about the pediatrics And last 4 weeks, we talk maternity and childcare. Like today, we talked about the cardiovascular disease. So now at evening, I'm going to talk about the cardiovascular. So cardiovascular means cardiovascular pediatrics. So we have to have a focus on congenital heart disease. Congenital heart disease, which is the most related to the pediatrics problem, because baby do not have hypertensive problem, baby do not have atherosclerotic problem, baby does not have any uh, myocardial infarction, angina, right? Baby have the heart failure, but this heart failure because of congenital heart problem. Congenital means when baby born with the disease, right? So when we go in the pediatric section, we have to give a focus on pediatrics cardio, pediatrics respiratory problem, pediatrics gastrointestinal problem. And Friday morning class or evening, we have to talk about the med surg adult health, or evening also med means medical surgical or adult health, 8 weeks, right? So this is the class casual with Zoom ID. I want to recap it. Monday I use this Zoom ID, but rest of 4 days I use my personal Zoom ID number is, you can see. Now I said something, I want to something different here. So here the textbooks, what I encourage the student to follow or buy. So this one, this is the Sender Comprehensive Review for NCLEX RN. Same book we have for NCLEX PN. Both books we have. Sender Comprehensive Review, this is the textbooks. This only one books for fundamental of nursing, for mental health, pharmacology, maternity, and pediatrics. So this is the reason I like these books. And I will also give you the PowerPoint. I also give you the PowerPoint. So all of this PowerPoint, system by system, I will give you before my class or after my class. You might be ask me from where I got this PowerPoint. This PowerPoint, every sentence on based of our textbooks, Sender Comprehensive Review. This is the NCLEX approved book for NCLEX review. So if you go here, index in this book, so you can see this book talk about or discuss the fundamental section first, then talk maternity nursing, you see, then pediatrics chapter by chapter, fundamentals here, then go for adult health, med surg, system by system, like intragumentary, hematology, endocrine, neurology, musculoskeletal, respiratory, renal, immune, and finally, mental health disorder, psychiatry, right? So everything we have to get from this book. And now this book you could buy from, so as I told you, you can buy this book, textbooks from Amazon, right? But the student who need the Center Comprehensive Review PN, you can buy this PN version. But I want to tell you the this RN or PN, these two books, the difference only the color, and previous one is called RN, this PN. But in between every sentence, every line, every chapter, absolutely same. Absolutely same. The LPN student must know all of the materials what RN students should know. Must know. Maybe any other day I will open the board requirements where directly mentioning this is essential for LPN, but LPN student must know the materials to pass the NCLEX board or licensing board. So I said, when you have this book, when you buy this book, same time you have to get a pin number. Okay, in page number 2, if you go and open here the page, okay, this is called evolve. So when you buy this book, you are not buying only this hard copy, you also buy 4,000 question bank. What is our real weapon for exam? So in the second page you get the link here. It's called evolve, right? Comprehensive. In here you can get a sticker. If you open up this sticker, if you erase it, if you peel it out, you can get a number, and then you have to go in the Google and type this evolve, right? If you type it, then you can open an account in evolve. And when you open, you can see the create account. You have to create your account and you have to put your name, and using this pin number, then you have opened this account. When you open this account, the PN book has to get this, the RN book, the RN student has to get this book. As the example, this is first, so I'm showing you this one. When you open and click in over the book, on the left side on bottom, you get the quiz and NCLEX test. You has to click here. When you click there, NCLEX included question, you has to open here. When you open, a new page will come like this. Then continue. When continue, the 3 section here. Step 1, step 2, step 3. Like today you are going to practice the question. You have to put.
They did give me a book already.
Who gave you book?
Dr. Voltaire.
Okay, so it is good if you have book, it is good, but I'm talking about for something, I mean some of the new students join with us, okay, and our things is we change some rules, okay, in the change some rules. So I said in that point of view we change something because our student number is increasing. We do not give the book anymore, we change, okay. So now I can say when you have this book, Then we has to go in the study. Then in the step 2, content area. When content area, the subject by subject question come. Okay, this is the big box and this is the small one. If you click on the small box, then again you can see, right? Cardio, gastro, hematology, immunology, then fundamental of nursing, maternity, pediatrics, and pharmacology. So, but I said don't click here, you have to click there, you can get chapter by chapter. Now I want to tell you, if you really want to pass the NCLEX board, every day you have to finish 100 question, right? And every day 100 question. So right, like example, the student work with me from Monday to Friday, 5 days a week. So Monday you have to finish 100 question. Thursday you have to finish 100 question, right? Every day 100. Like Monday you have to finish 100 question from fundamental of nursing. Tuesday you have to complete 100 question from psychiatry or health assessment. Then Wednesday 100 question from pharmacology, right? Thursday 100 question from maternity or pediatrics. And Friday, Saturday, and Sunday you have to get question 100 question per day from adult health. So when a student works so hard, 100 question per day, right? 100 question per day, they can finish this total 4,000 question. So if I select all, you can see 4,486 question total. 100 question per day. So you need 40 days. 40 days. 40 days means 1 month, 10 days. And according to this schedule, I have a target. We finish everything by 8 weeks. So maybe we finish it that 20th of December. Okay. So I like to request you, take a challenge, continue, do your hard job, and go and finish this total subject. At least you can say, I have done fundamental, I have done mental health, pharmacology, pediatrics. Not only PowerPoint, also the question bank. This standard 4,000 question can help you to pass your licensing exam. But I can tell you something from my experience. The student who do not finish this 4,000 question, it is difficult for them to pass. But the student who finish this question, the chance is more than 85%. 85%, right? But what about the rest of the percentage of passing? When student finish this 4,000 question, then we tell to finish this one. Only 1,000 question is here and here. NCLEX PN and NCLEX RN. So the student who go for PN, they has to finish this, and RN student finish this one. You see something right here, alternate format question. In this book help you to answer, select all category question. Some of the questions picture, flow chart, right? Mathematical question. this book can help you, or this can help you for PN student. So not only this, we have to finish this as well. So these 8 weeks means more than almost 2 months. But to finish the 4,000 question, you need 1 month, 10 days. If
1 month.
10 days, yeah, 4,000 question. This
Oh, doctor, excuse me. You using the 7 edition. Me, I have the 8 edition.
it is
I got 6,037 question.
okay.
On yours, you have 4,000 something.
Okay, but basically the new
Mm-hmm.
edition, some increase some question. Is it LPN or RN?
RN.
RN, yeah, RN even I if I go here,
Mm-hmm.
this edition, I mean RN version, also the question number is increased. But I said whatever the edition, don't
Don't
spoil.
worry about that.
No,
Okay.
no, no, do not need. Do not
Okay.
need. Just give a focus to complete it. When
Completed. Yeah.
once when you have done, then I give you these materials. But my
Okay.
first requirements to finish this question bank, okay? Total 4,000 question. And this
Okay.
question help you to pass your NCLEX board. So
Okay.
what I'm saying, like
Mm-hmm.
Monday, 100 question from fundamental, Tuesday, 100 question from health assessment,
Mm-hmm.
mental health, then
Mm-hmm.
Wednesday, 100 for pharmacology. So this is the way we
Yeah.
supposed to work.
Okay.
So thank
Dr. B,
you. Yes.
okay, we have to start it after when you finish the 8 weeks, right?
Yeah,
No.
yeah.
When the 8 weeks is over, because we cannot do two things at the same time.
No, no. You did not work with me 8 weeks. You did not work with me 8 weeks. And these 8 weeks, I am going to review everything, but keep in mind the my batch already they are like I have a one batch in Friday and Saturday. They just sitting for the board exam. Already some of them sit for the exam. My regular batch, they also successfully done. And some of the student, I'm very much hopeful they make it. They're going to make it. Like, but I did not work with respect with all faculties. With respect to you, I want to say you do not work with me. You do not work with me. But I'm saying again, I know I do not have any magic. I do not have any magic. Magic in your hand. Okay. Even you do not need to brain, but it is important how you thinking, how you utilize your time. Do you finish 100 question every day? One question, just ask your heart. Do not need to share with me. Just ask, did I do 100 question every day last 2 months, last 3 months? Then ask, did I organized way to go forward? Did I make a plan? Did I make a note? Okay, this is my timeline. 8 weeks, I'm going to finish this fundamental of nursing, health assessment, mental health. After 8 weeks, okay, at least I can say I have done question bank. I have done these small materials. Now two question come. It is very true. I have a lot of weakness. I am Dr. B. I have a lot of weakness. Every day I'm learning too. But my all students are not pass, right? But most of them are. Now, another thing, the student who pass, is it not my credit? It is their credit. The student who fail, it is not 100% my responsibilities. Again, I want to say with you, my friend, when a student come to the school, what is their goal? Their goal They said, I want to sit for NCLEX board. So when the student finish the program, we give them certificate. And this certificate are mentioning the this student name, complete the LPN or RN program. And same time, we send you document to the Board of Nursing. You get ATT number and you take the exam date and you can sit. Basically, 100% school do up to this, 90% school do this. But here it is our own headache how student pass the NCLEX board. So the student when join in my school, we try to give them how to pass it. Second one here, like I want to share the story with you. Like last batch, I work with them. I work almost 9 months. 9 months. After 9 months, they finish everything. But in this batch, like this batch, what I start last week, this batch actually a very cocktail batch. Cocktail, I said. Some of the students are the I mean, transfer student. They finished the program from different school. Some of the students came for remediate program. Some of the students already finished the school program with other faculty. They just try to review it in a short review, right? And some of the student is my own student. For that, every student do not have all the time assignment as well. And I said, we know who for what, and definitely the student who needs something more, the school communicate with them. Lastly here, again I said, you can think this 8 weeks is nothing, but we push you a little bit go forward. Still, if you are sleeping, it is not possible to wake up. If you do not wake up by yourself, now I said, when we are go through the system, any system, and we invest money, that times we cry for the money, cry for the time, and somebody is pushing up and we move. Even from my life, I can say, when I go for my master's, I have a two master's program degree, one from America, one from England. If from university, I said. So I went for university in my life. So when I invest money, either it is federal student loan or anything, this today or tomorrow I have to give money from my pocket. I feel, oh my God, I'm giving money. So now I has to study. And when they gave me some rules, yes, this is the timeline. You have to finish, otherwise you do not get any paper. So I work, I run, right? And finally I make it. But I said, when you go and start in this schedule, right, you will be speed up. Again, I said, if even you can do by yourself, but you do not do last 3 or 4 years, right? But now 8 weeks, we try to make it. We try to make it. Just help me, work with me. Let's see what happens. That's it. So if you have any question, please ask me. We want to share, but same time I want to say, yes, I have more clue how to pass the board exam, but it is too early to share with you. And other things is, if I share every day, everything by one day, tomorrow you will not come. And third things here, it make you lazy, and I don't want to make you lazy too early. Okay, maybe if God will, we work together. I will open some question, I will discuss it, and we will step up. So definitely you have to give me time, you have to have the patience and give me the opportunity to explore myself as well. So here, so now I was talking about this sender book, then our schedule. This is the, I mean, for PN, Lipin code RN, Lipin code PN, and this 4,000 question, right? Now, let me see. Okay, any more question, please? I believe maybe no question right now.